This patient came to see me in 2014. So 9 years ago, more than 9 years ago. Because look, it was 122 2014. So January 22, 2014. So let's call it 9 years ago, but more than 9 years ago. Almost 10 years ago. For endodontic treatment of tooth number 31, as you can see, periapical lucency associated with the tooth, and patient had symptoms. Later, the same patient came to see me for tooth number 30, and I'll show you the following year, 2015. So take a look here. 2014, so 9 years ago, for endodontic treatment of tooth number 31. As you can see, periapical lucency associated with the tooth, crown on the tooth. So we talked about options. Patient said that he wanted to try to save the tooth. So we went through the crown and did the root canal in one appointment. Again, one appointment. Periapical lucency, we did the root canal in one appointment. And this was immediately after we did the root canal for him in 2014. So 9 years ago, almost 10 years ago. So because we saw him January 1st, January 27th of 2014. So almost 10 years ago. Right here, as you can see. 127 2014. All right, so immediately after we did the root canal for him, again you can see the periapical lucency here and here, and as I said, we went through the crown and did it in one appointment. Okay, and again here's the date. All right, so a few months later, patient came back to see me for tooth number 30 now, and tooth number 30 had abscessed. So as you can see, periapical lucency here and here. And this was 2015, 9/23/2015. Okay, which would have been a year post-op of tooth number 31 at that time. And as you can see, periapical lucencies are kind of healing, but patient had no symptoms on tooth number 31. So again, you can see the periapical lucency here on tooth number 30. So we went ahead in 2015 and did the root canal on tooth number 30. We went through the crown and did the root canal again in one appointment. Okay, so take a look. And this was immediately after we did the root canal on tooth number 30, again in one appointment. Went through the crown and did the root canal in one appointment. Again, you can see that's the date, 9/29/2015. All right, so it would have been 1 year post-op, almost 1 year post-op of tooth number, 1 year, like 9 months post-op of tooth number 31. And we went ahead and did the root canal on tooth number 30 in one appointment. And it looks like maybe I accidentally obturated a little bit long. Will that cause endodontic failure? Let's take a look. Here's the post-op. So take a look. That was just now today, 11/14/2023. So we did this root canal in 2014 and did this root canal in 2015. So 2014, 2023, that's 9 years, and this is 8 years. Post-op of teeth number, 9 years post-op of tooth number 31, 8 years post-op of tooth number 30. Patient still has the same crowns as when I saw him 9 years and 8 years ago. Went through the crown and did the root canal. The endo axes were filled with composite. So we did this root canal in one appointment in 2014. So 9 years ago. We did this root canal in one appointment in 2015, so 8 years ago. Both teeth are in full function. Patient is asymptomatic. Periapical lucency is healed. This is not a periapical lucency. As you can see, this is normal bone anatomy. You can see it all over. These trabeculations, it's just superimposed on this area here. Again, same thing here. This is normal bone anatomy. As you can see, you can follow the periodontal ligament all around. So you can see these radiolucencies. These are normal. They're all over. You can see they're all over. Sometimes they superimposed on the root, these areas, but you can see this is normal. This is all normal here, normal here. So 9 years and 8 years post-op of teeth number 31 and 30. As I said, the patient still has the same crowns as when I saw him 9 years, 8 years ago. The endoaxis were restored with composite, but no symptoms. Both teeth, as I said, are in full function. Periapical lucency is healed completely. We did these root canals in one appointment. And remember, tooth number 30, I had obturated a little bit on the longer side. Accidentally, gutta percha was sticking out. What happened to that gutta percha? Is gone. So 9 years post-op of tooth number 31, 8 years post-op of tooth number 30. One appointment. Root canal is as good, maybe even better than multiple appointments, as long as you can get the canals dry before obturation. The extent of gutta percha, the extent of obturation, does not have any effect on the outcome of the endodontic treatment. Again, I'm not saying that. Multiple studies show that, and also I've posted hundreds of these cases showing the same thing. What causes endodontic failure is bacteria, not the extent of obturation. Sealer extrusion doesn't cause endodontic failure. Extent of obturation doesn't cause endodontic failure. One appointment, doing a root canal in one appointment doesn't cause endodontic failure. Those are all old wives' tales that were pushed to you, pushed in, and you believe them, but they're wrong.